Hello, everybody. Here's Dr. Lucas Fessinone. It's a big pleasure to me to come here to summarize all the presentations that we have in the last American Academy of Dermatology Congress here in Tampa, USA. It was hundreds of presentations, but I'd like to present to you the most important news about trichology and hair problems. And I have some photos that I took here in the Congress I'd like to share with you. The Congress was here in Tampa, Florida. It was 4 days, and each day we have some presentation about hair loss. First of all, I'm a member of the biggest societies of trichology over the world, like the Association, the Argentina Trichology, Ukrainian, European Hair Research Society, World Trichology Society, Società Italiana di Tricologia, and soon from the International Association of Trichology. And I also have the biggest YouTube channel in the world about hair problems with almost 3 million subscribers that you can check on the website. We have a lot of news over there. Let's start with a presentation of Dr. Antonella Tosh about their hair loss and COVID-19. She talked about the problem of the telogen effluvium that happen very often with the patients that have this problem. One very important information that she told in the presentation, it was about the Spinola epidemic. The main symptom, it was telogen effluvium. So almost 100 years ago, they described the telogen effluvium as a big problem from the pandemic. And today, in 2020 and 2021, we have the same problem with hair loss. And in the presentation, Dr. Antonella Tosi showed us once the meeting of the start of the telogen effluvium, that 1.5 months is not so long like the regular telogen effluvium that can take 3 to 6 months, and it lasts for 3 months. So 3 months normally it sows by itself. And another very important data that Dr. Antonella Tost showed us in the presentation, it was about a study that compared the incidence of the COVID problem with the persons that was doing the hormone therapy to problems with cancer. So there are some patients with cancer that was treating to androgenics, and that almost saved a lot of the use of some medication. And it was interesting, the relation about the androgenetic alopecia and COVID. Some patients have a relevance of 71% of persons that have the COVID and main symptoms of the androgenetic alopecia with the Hampton-Norwood scale 2 anhydrous. And the other studies show a prevalence of 31 to 53%. And the androgen deprivation therapy can be protective to COVID-19 because it can decrease the receptor of the DHT. So some patients that was taking this kind of therapy to prostate cancer have less COVID symptoms, complications than the other patient that didn't take that. So we know that patients with cancer are patients that have increased risk to SARS and COVID, but these specifically patients treating the prostate cancer, they don't have so much problem with the COVID. Another very interesting study was presented that about the relation of anti-androgenous as a treatment against the COVID. Some patients that was taking the anti-androgens like dutasteride have less internation in the ICU, and that people that was not taking this kind of medication have a lot of complications and need more intense treatments. So another very important data that shows the importance to do a treatment with the anti-androgens like dutasteride, finasteride, spironolactone for women. And in the Congress was presented to you about the telogen effluvium, and the main cause is very important to know that it looked like the same, but there's other reasons for it happen. Like from the top combinoctile with a premature detachment of the telogen hair, or it can happen like the increased duration of telogen phase, like it happened in the seasonal shedding, or for the hormonal problems that can make an elongation of vaginal length. So it's very important to know that it can cause the same problem of the hair loss from the telogen effluvium, but the cause normally can be different. So it's very important to us trichologists to be aware of these situations. And if you see here in the telogen effluvium, the trichoscopy, we can't see exactly the vellus hair. We just see the terminal hairs. Every follicle, we can see there's one or two strands. It's not so common to have more of that. And we don't see a difference between the diameter of the strands. It's look all the same. And we see, when we see the trichoscopy of the genetic alopecia, we can see here the hair regrowing. We can see the difference between the size of the hairs. There's some terminal hair, there's another vellus hair, and we can compare with the trichoscopy if it's happened the problem of telogen effluvium or the androgenetic alopecia. And it was presented about the telogen fluid, the duration of the shedding that takes around 3 to 6 months. Normally, the patient is very anxious to treat the hair loss and stop the hair loss and don't have to wait for this time. But I think it's very important for us to show to the patient that he needs to be very patient, to wait for 3 to 6 months to cease the shedding. And the regrowth takes another 3 to 6 months to see the growth, because the patient starts to take the pills like today, and the next week he wants to see the results. So it's very important to show to our patients that it's gonna take 3 to 6 months, and probably the regrowth that you can see cosmetically gonna take it to 12 to 18 months. Because of that, I think it's very important to take photos of the treatment, to show in the trichoscope what's happened, because in this way the patient can see the hair growing and can see the treatment that is going everything well. And the conclusion of this presentation is that the alopecia androgenetic alopecia and the flavic telogen can coexist. So it's very important that we think about to treat the main cause of the disease and to treat the telogen effluvium. Actually, there is no specific treatment for telogen effluvium, but we always have to think about what's the problem, what's the base of the problem. And this presentation, which was very interesting because it shows two very similar cases, but when you do the trichoscopy, you can see the difference. Here, the first case, it was a guy with a patch alopecia in both sides of the frontal area. And when you see like this, you can think it's like a baldness, but when you look at the trichoscopy, you can see that it's a case of alopecia areata. We can see here the yellow dots, and we can see here an exclamation mark. And in this case, if you see without the trichoscopy, it looks like the same. But when you look with the dermatoscopy, with trichoscopy, you can see there's just a vellus hair. This is a triangular alopecia that happens very often in boys, not so often like in the both sides like this case. But it's interesting to see a case that if you see with no instruments, it looked like the same. Another case that we can see here, if you look with no instruments, it looked like the same. In this case, you see some patch alopecia, and when you look in the trichoscopy, you can see the black dots, you can see the yellow marks, yellow dots, case of alopecia areata. And in this case, you can see a lot of inflammation, you don't see the black dots, it's a case of paniculitis. So when you see the first time the two cases, you can think it's the same disease, but when analyzed, we make a design with a trichoscopy, you can see it's a completely different case. Another very interesting case, most very similar when you look at with no instruments, but with a trichoscopy, you see several of hair strands clothing for the same follicle, that is decalvant folliculitis. In this case, we see a lot of black dots, the yellow dots, and some exclamation marks, a case of alopecia areata. And it's very important to know that some cases you do the trichoscopy, but even with this exam, you can have the result of what is the diagnosis. So maybe sometimes you have to use the biopsy that we're gonna see maybe in the next presentations here. Another two cases that it's look very similar, but in tracheoscope you can see a perifollicular scales, and you can see with a little bit more zoom here that is lichen planus pilaris. In this case, we just see the yellow dots in a case of alopecia areata that was not treated so soon. So very nice to see very similar case, but when you use the tracheoscopy, it looks absolutely different. Another two case that is very interesting, two very young guys, boys, with a patchy alopecia. And in the first case, you can see the exclamation marks. You can see some black dots, case of alopecia areata. And this is another case of triangular alopecia. Normally, it happens the frontal area or temporal area, but in this case, it happened in the vertex. Is a very, very uncommon presentation of this disease. So I think it's very important to us to know that can happen in other place of the head, so we can make the diagnosis, and even we can make the diagnosis using the tracheoscopy. And here, three cases very similar, but when you do the tracheoscopy, you can see this last one, you can see the corkscrew hairs, you can see some broken hairs. It's a sign of tinea captis. And in the first one, we have the exclamation mark, black dots, some sign of the alopecia areata. So it's very important to us to look at first look, but after that we do a complete exam with a tracheoscope to have the exactly diagnosed. And here, I think it's a very important case that we have to remember every time that we see some case like this. It can be confused with diffuse alopecia areata, but when we look in the tracheoscopy, we see all these broken hair strands, and it can be the syphilitic alopecia. So it's a very important case that maybe we can do this diagnosis just with tracheoscopy without the laboratory tests. Some cases very important to have the right diagnosis, because this kind of disease will have to treat it with antibiotics, so and it can spread to other parts of the body. So it's very important to do the very, very fast diagnosis. Now talk a little bit about the biopsy. We have to remember that the biopsy can be studied in a vertical cut or horizontal cut. And we have to remember that it depends of each level of the biopsy for each disease. There's some disease that we're gonna see some alteration in the layer, the outsider layer, and another disease we're gonna see some problems with the deepest layer. Because of that, it's very important to do the right biopsy and send to the laboratory that is used to do this kind of exam, because it's necessary to do around the 20 cuts to have the good result. And here we can see that's about 20 sections are sufficient for the diagnosis. And we can see a very interesting image that we can see how deep it goes, the biopsy. Here, the fat tissue, the deepest one above the dermis, and in the level that we're gonna find some kind of problem. And in this image, we can see the difference between the non-scary alopecia and the scary alopecia. Here we can see the sebaceous gland, we can see the follicles, and here we can see the scars, and we can see that it was lost, the sebaceous gland. We see just the scars tissue, the place of the sebaceous gland. And we can see the perifollicular fibrosis and inflammation in this scary alopecia. And here we can see several levels of the sections that was made in the same biopsy to understand how it's important to locate the exact level to know where happened that kind of disease. And the right technique to do a punch biopsy should be with a 4 millimeters punch biopsy. In this case, we have around 12 to 14 follicular units, and we have a circumference of area of 12.6 millimeters squared. And when you use just a punch a little bit smaller with 3 millimeters, we have just almost the half of the area. So because of that, it's very important to use the right punch, the punch with 4 millimeters, because we can use a good material for the diagnosis. In some cases, like the FFA, the frontal fibrosing alopecia, we can use the 3 millimeters punch that can be very helpful. Actually, we should take 3 samples of the biopsy to have more accurate results, but it's very hard to do that in the office. So normally one biopsy very well done, it's good to, it's enough to have a diagnosis. And one case like this of the alopecia areata, we could do the trachoscopy, but it's very interesting to see what happened in the pathology with the aspect of the swarm of bees in alopecia areata. We can see here the lymphocytes attacking the follicle, and it's very nice to just see what is happening deep in the skin layer with the pathology. And this presentation, it was very interesting because it compared the chronic telogen effluvium. We can see here the photo. After that, we can see the trichoscopy. We can see the vellus hair. We see almost the hair strand with the same diameter. And here we can see the diameter of the follicles. And it was did the count about how many anagen hairs the telogen, and proving that it's really the chronic telogen effluvium. And it's very important to check the size of the follicle, because in the next slide, we're going to see about the androgenetic alopecia. Look at this one. The androgenetic alopecia, we have the miniaturization of the follicle. So you can see the follicle much smaller, and we can see the photo of the patient, and in the trachoscopy that the hair follicle, it's rising with 1 or 3 strands, and we can see a lot of vellus hair. And this vellus hair we can see here in the miniaturized follicle. If we return again here in this slide, we're gonna see again the size of the follicle, the chronic telogen effluvium, and when we come back here, we can see a much smaller follicle. So it's very interesting to see that. And in this presentation, it showed that it's very important to use the trachoscopy to do the biopsy. You can use the trachoscopy to choose the place to do the biopsy, because you can be much more accurate. Like in this image, we can see a point that was showed that was choosing to do the biopsy. We probably it's leaking planus pilaris because of the absence of the vellus hair and the presence of perifollicular scales. So very, very important to do this, the dermoscopy, to find the right place to do the biopsy. In this case, we can see exactly what was it. We can see the image of the hair. After that, we can see the dermoscopy, the trachoscopy, the guided biopsy. We can see here the absence of the vellus hair and the presence of the perifollicular scales. And we can see here in the pathology this fibrotic tissue around the follicle. Very nice to see that. And it's very important to remember that case like this, we don't need biopsy, because we just know the treatment and we know the diagnosis. Like a case of frontal fibrosing alopecia, we could use here the trichoscopy, it will be okay. But there are several cases that is difficult to treat and to do the diagnosis, like this one, a beard with a patch. We can think about the leaking planus pilaris, we can think about alopecia areata, we can think about syphilis. So it's important to do a biopsy. Or some case like this of the hair loss from the eyebrow, it's very important to know exactly what diseases happen. And it's very important to remember some specific case like this, the patchy frontal fibrosing alopecia, that don't happen so in the front like the regular case, but we can see a patch with no hair. In the dermatoscopy, we can see here there's no vellus hair. We just see the lone hairs, and sometimes with a little bit of scales. And the pathology, we can see here the scar tissue too. And this article was presented about this kind of patchy frontal fibrosing alopecia. It's very important to know that can happen. And it's very important we always we have some problem with patient with this kind of disease, we have to do the thoracoscopy the occipital area, because it's very common to have the association of this kind of patchy frontal fibrosing alopecia with occipital fibrosing alopecia. So sometimes the doctor treated just the frontal area and forget the occipital area. So it's very important to we remember of this part. And then when you think about the biopsy, it's very important to remember what level it happens, because sometimes the frontal fibrosing alopecia is in the beginning. So if you look in the biopsy in the bottom, you can see exactly what's happened. But when you look in the part most closer to the dermis, you're gonna see that the velar hair, some vellus follicles involved could be missed at lower level. So it's very important to check every level of the biopsy to know exactly what's happened in some case. In this presentation, it was very interesting too, because when we do the thoracoscopy of the frontal fibrosing alopecia, we can see some parts with the arteries. And what this happened? A study showed that one study showed that the dermis in this kind of problem gets thinner. Because of that, you can see with the thoracoscopy what is happening here. You can see the vessels, you can see the arteries. So it's very important to remember that happens. So if you have a patient with a frontal fibrosing alopecia, probably the skin is much thinner than the regular. And another very interesting disease that can happen to the hair is rosacea. Normally, we are used to see rosacea just in the face, but we have to remember that can happen some hot spots in the scalp. And if the patient have some problems, some pain, when the patient eats some pepper or drink wine, he can have some flares in the face and even in the scalp. So if the patient complain of this kind of problems, it's very important to us use a thoracoscopy to check if it does not happen rosacea in the scalp. And it's very important to we remember the indications of biopsy. Sometimes no responsible alopecia areata can be shown in the biopsy. That's not just alopecia areata. Like lupus, it's a very important disease that should be treated systemic way, just not in the specific way. And it can be sometimes the alopecia areata that don't respond to any treatment can be a metastatic breast carcinoma. It's not so common. It's a very rare disease to happen in the scalp, this kind of metastatic breast carcinoma. But I think it's very important to always that we see a patch in the hair that you don't get better with any treatment. It's very important to remember about that. And then another very important indication for biopsy is the diffuse alopecia areata. That is very hard to find the diagnosis just with a thoracoscopy. And for me, I have several cases of patients that did like 1 year or 2 years of treatment and didn't get better. And after that, we did biopsy and we discovered that it was diffuse alopecia areata. We started the treatment, the specific treatment for this disease, and get much better. So it's very important to remember that. And a fun tip that it was told in the Congress, it was about the biopsy, because sometimes we do the biopsy and there's a lot of blood. It's very hard to control the bleeding. So you can use a surgical foam. You can cut a small piece of the foam and put in the hole that we do of the biopsy. Use the punch, take the piece, the fragment of the skin, and you put the phone over there and just leave it. About 2 to 3 days, it's gonna close for a second tension and gonna give you scars like this. In my experience, these scars is not so good. You can do some stitches. When we do some stitches, normally gets a little bit better, but it's harder to do like that too. And here, just to remember some treatments for leaking planopilaris. We can use steroids, we can use topical and systemic calcineurin inhibitors. We can do hydroxychloroquine and retinoids, pioglitazone. and low dose naltrexone, mycophenolate mofetil, methotrexate, tofacitinib, excimer laser, and laser cap. About the low dose of naltrexone, it was told in the presentation a very interesting way that you can do the right dose for the patient. You can crush 50 milligrams tablets and add 2 ounces of 2 boxes of orange juice. 1 ounce is like 30 ml, so it should be like a 240 ml, and you're gonna make a concentration of 1 milligram for each milliliter. So we can stew each morning and refrigerate and take 1 teaspoon of the mixture. And it's very important to remember that this treatment for low dose naltrexone can be used for the lichen planularis and for the frontal fibrosing alopecia too. And in this case, it's important to remember that can be treated with dutasteride. Dutasteride is a drug especially for men, but with postmenopause, women can use that too. It's very, very good, some good results. Myself, I have a lot of cases of patients with a frontal fibrosing alopecia that use dutasteride. It was very good for them. This was a very interesting case that we saw in the Congress about hair purification here in the mustache area. The patient was a 60 years old lady with a lot of facial hair, especially in this area, but suddenly it started happening in the nose. So she was concerned about the hair, the nose, and seek a doctor. And the doctor running some exams, some laboratory tests, and discovered she has ovarian cancer. So the ovarian cancer normally produce more testosterone and other kind of androgens, and this is increase the amount of the facial hair, and they happen to grow in the nose. So very important to really examine the facial hair, the hair body to look for if any sign of this, and think about like a problem very important like this of cancer. This presentation, it was very important because it showed the safety of the spironolactone about the bad formation with some dose like 400 milligrams. Normally to treat hair loss for women, we use some dose of 100 milligrams, and in humans, 5 males were born to mothers with renal disease who were treated with spironolactone before and during their pregnancy, and no evidence of feminization despite exposure to dose as high as 400 milligrams a day. So it's very important because the spironolactone was used before and during the pregnancy, and with those even 4 times higher than that used in the hair loss problems and treatment, and there is no problem of feminization. So spironolactone is very safe to be used in hair loss and genetic alopecia in women. And there are other studies that show that can be used even with a historic of the breast cancer, because there's no problem with that too. And a very important concern about the use of spironolactone is about the hyperkalemia, about the potassium, because it could rise the level of the potassium in women or that use that kind of medication. And this study was very important because it showed that it's not necessary to do laboratory tests about the potassium. It's very safe to continue use the spironolactone without doing this kind of laboratory tests. And just to remember here that the testosterone, when affect the scalp, the DHT can make the hair thinner and miniaturization, but when it hits the body hair, it can make it like a terminal hair. It can turn vellus hair in a terminal hair. So it's very important to remember that, especially in women that suffer from problem of excess of androgens. And it is very important to remember the signs that braids are too high. Here in the United States, it's very common that people use some kind of afro hair and dreads that is a lot of pressure in the hair. But if your patient is feeling some pain, is having very common folliculitis. It's very important we remember that it can happen some traction alopecia. And it's very interesting that it will show about the sign of traction alopecia called the flambeau sign. That is like a white flame that grows from the hair follicle, showing that the hair is under a very high tension. So if you will ask to your patient if there's pain, if our patient have a folliculitis, or we can see this from both sides, the trichoscopy, it's very important to us. So think about the traction alopecia and try to solve that and chat with the patient about that. And we have to remember about the other disease that can make a patch alopecia like this, like lupus paniculitis of the scalp, that can be presented in 3 types: the linear lupus paniculitis, the patch one, and the ulcerated lupus. Sometimes the patient is treated like a patch alopecia, like androgenetic, like a alopecia areata, but it can be a case of the lupus. So it's very important to know about that. And we have to remember that DHT levels can cause the follicular maturization till sometime there are no hair follicles. In this case, just the hair transplantation gonna work. So it's very important to treat the hair loss, the androgenetic alopecia, as soon as possible. And when we do the trichoscopy of the hair, it's very important to don't use the immersion fluid. It's very important to use it every time in the dry trichoscopy, because we can see sometimes the vellus hair and we can think that the vellus hair is not there. Like this image is very important that here we can see the vellus hair, but here we can't see that, and we can think about other diagnosis, so it can be dangerous to do that. So always we have to do the dry trichoscopy. And here it's a draw to remember the difference between the androgenetic alopecia and telogen effluvium. In the androgenetic alopecia, we can see some follicles with one strand and a vellus hair, or just one strand. And in the telogen effluvium, we see just one strand or 2 strands without this vellus hair. So it's important to remember that. And it's interesting to see how the oral minoxidil and dutasteride is becoming very common around the world. This is a presentation of Dr. Lydia, one of the biggest hair specialists in the world, showing that what she does for women and for men. And it's very important to, every time that our patient has some problem of hair loss, we talk to him to quit smoking. So the dose of oral minoxidil can start off with 2 milligrams a day and be increased to 5 milligrams a day. With this dose, we see some good results and without some complications. I take some oral minoxidil for 6 months and my hair gets much better. So, and I use the dutasteride like this presentation too. In problems of tinea capitis, it's very important to remember some problems that we can see in trichoscopy. The coma hairs is very common, the corkscrew hair. And it's very important to remember that the corkscrew is different from the pigtail hair. We can see the Morse code-like hairs with some bands in the hair. The zigzag hair, it's very common in the tinea capitis, and the eye hair too, we can see in this kind of problem. It's very important to remember that tinea capitis happens very often, mainly in children, but like in this case that was presented, it happened in a 6-year-old family that was presenting 1-year history of profound diffuse hair loss and scaling. It was presented that this lady was treated for 1 year with another doctor, and the diagnosis it was wrong. After that, when the diagnosis is right, we can see here the trichoscopy some breakage, hair break, and we can see the corkscrew signal here and a coma hair too here. This slide was very important because it showed that a lot of patients that have a frontal fibrosing alopecia have the problem in the occipital area. So every time that we see a problem in the front area, it's very important to look in other places of the scalp, and especially in the occipital area. Here we can see the absence of the vellus hair and the perifollicular scale. So a typical case of frontal fibrosing alopecia, but in this case, it happened in the occipital area. This image is important to remember about the microneedling. We see some device that people buy at the internet and try to do by himself at home, some home device. But it's important to remember that the deepest ones is the most effective, that the medical grade device, it's around the 2 millimeters or 2.5 millimeters and can be used for drug delivery. So it's a new way that you can put some treatments in the skin without so many complications. And this slide presents the new use for low-dose oral minoxidil, not for just androgenic alopecia. Let's remember that the use of oral minoxidil was described first for Dr. Warden Sinclair from Australia, from Melbourne, and now it's been using for another disease like alopecia areata, frontal fibrosing alopecia, lichen planus pilaris, Telogen effluvium. So it's a lot of uses of this medication. We have a presentation about some new methods to evaluate the hair loss. This is the age to age, the hair to hair matching, that it make a hair count and make like a tattoo, a virtual tattoo, a specific point of the scalp, and we can count every hair strand to check the growth, what has happened. So it's very important how the artificial intelligence is gonna improve the trichology field. Here is another kind of new exam to check the hair growth with artificial intelligence that shows the follicles, and after 6 months, what happened with that in the same specific area. Here about some ingredients that is very important to remember. It's important to remember that biotin, there's some warnings about the FDA that can interfere in the cardiac and thyroid test interference. It's not exactly in the hormone of thyroid, but in the laboratory test that use biotin can have some interference. So every time that you prescribe some biotin for your patient, it's very important you say to him that every time he's gonna do a laboratory test to take care with the result. And it's very important to remember that vitamin E and bleeding issues, and vitamin A that can cause hair loss. We see a lot of multivitamins in the market that have a lot of vitamins, like vitamins from A to Z, and we have to remember that vitamin A and isotretinoin, like Accutane, is a cause of hair loss too. We have a lot of new treatments about hair loss, and one of them is the platelet-rich plasma. And this study was very nice because it showed that the most part of the platelet-rich plasma that is done at the clinic are not trustable. So the amount of plasma is not enough to get some good results. Here it was a presentation just to us remember about the scalp health. It depends of the hormones, mainly in the DHT levels. It's very important we talk with your patient about diet and styling. That's very, very important to a very healthy scalp. About what happened in the day with stress, UV light, and genetics tissue. And it was showed a study very interesting that compared the use of shampoo, everyday wash, 7-day wash, and everyday wash. So we can see here that in the 7-day wash, we can see a lot of scales, and everyday wash, we can see the scalp is much cleaner. So we can see internet a lot of tips about taking a shower and wash the hair just once a week. That's good for your scalp. But we can see in this study performance by the aesthetic dermatology that it shows that everyday wash is much better for a scalp, healthy scalp. And here's some of the current theory of hair loss that involve the stress, the DHT levels that we can fight with dutasteride or finasteride, some free radicals like aging, UV light that we can have the normal day that you can use like something like a curcumin or resveratrol, inflammation, oxidative stress, and compromised circulation. Because of that, is being using so much the minoxidil, the oral minoxidil low dose that can help in this point of the compromised circulation. So very, very important to remember that the hair loss happened because all these factors, and when we have our patient, we have to remember of every problem that what you can do to improve each point of this. This is a study that showed the result for scalp microneedling in females. So we can see the results after 2 months of the microneedling. And it is very important to remember that microneedling can be used like a drug delivery, that we can use a lot of other products that help the hair growth. Another study that was presented about the skin molding to promote hair loss, and we can see the photo after and before 4 months of treatment. And this is very nice because in this scale of the Sinclair scale, that's a hair loss scale, it changed for one, change a lot in 4 months too. Here, I think it's very interesting is the protocol of the Scientific Dermatology, how he combine all the treatments from in kind for all disease. So normally, Dr. Sadek don't do just one treatment. He combined like spironolactone, LLT, red light, and microneedling to have better results for each case. And this presentation was very important because it showed the role of iron, the ferritin levels in people that suffer from hair loss. So they compared the people of FPHL, the family pattern hair loss, with family health controls, and showed that the level of ferritin in people that suffer from this problem of hair loss is much lower than the controls. And this happened more common. It's easier to see at premenopause status in women that suffer from bleeding or from breastfeeding or pregnancy, that can put the fertility levels much lower. And this presentation is very interesting to see the fluctuation of the hormones of the woman, because that is much harder to treat the hair loss in women, because there's a lot of change in the levels. Here we have a difference between the phytochemicals and the extracts. It's very common that people buy just the natural components and think about the efficacy, and we have to think about what's really matter in that natural component. That is the phytochemical, that is much similar to the pharmaceutical model. So when we have to buy some kind of a natural component, it's very important to think about that. And a very new study, it was showed about the curcumin platyclage, that is a traditional Chinese medicine that can inhibit the 5-alpha reductase, reducing the levels of DHT. And it was compared in the mice, and the DHT level is compared to finasteride, so it should be very effective. This presentation, it was very interesting because it showed the effects of the probiotics in the hair growth in mice. It was used as control, and the group with probiotics showing that the proliferation of the follicle was much bigger with the group of the probiotics. And it was studied what is like the probiotics that happened to the hair growth in these mice, and it will show the Lactobacillus reuteri, it was the most important. If you compare with the control, you can see the proliferation of the sebocytes, and the follicles was much bigger with the control, with the group that used the Lactobacillus reuteri. And it's very important that the gut have a communication with the skin and acne. And this study showed that the mucoprotein, predominantly the whey protein, leads to worsened acne. And it's very important to remember that some people that suffer from acne suffer from oily scalp. So with oily hair can have more problem with DHT levels and androgenetic alopecia. And this study showed that the 6 case that use the whey protein with a flare very important in acne and can lead to hair loss and rise of the DHT levels that can turn in problems of hair loss too. And it is very important to we say to our patients about the diet, and it was showed that high glycemic diet is related to worsening acne, related to rise the levels of DHT, and this can increase the hair loss too. So we have to take care with this the kind of diet that may stimulate the increased level of insulin and IGF-1 too. So this is just a few presentations that happen here in the American Academy of Congress, Dermatology Congress here in Tampa. There's a lot of more information. If you'd like to know more about trichology, we can check out my YouTube channel. Every week we put 2 videos about YouTube, about the hair loss problems. It was a pleasure to me to bring you this information. And if you need more help or like to know more about any presentation, please contact me. Thanks so much for watching. See you in the next videos. Thank you. Bye-bye.